Assalamualaikum, my name is Nur Afika binti Muhammad Sim. My matric number is 272536. Today, I would like to present about the introduction breast cancer. In Malaysia, breast cancer is the most common cancer among women. The woman's breast consists of lobular glands, cells that produce milk, ducts that carry milk to the nipples, fat and intermediate tissue, blood vessels, and lymph. The majority of breast cancer begin in the cell lining the duct, which is ductal cancer, while some begin in the lobular glands, which is lobular cancer, and the remainder begin in the other tissue. The organ may grow again if these cells spread to the other area of the body. The term cancer can also refer to an abnormal state of cell proliferation that is not accompanied by the growth or tumor. The oldest form of cancer known to humans as a tumor is breast cancer. Since approximately 100,000, the ancient Egyptians have been aware of the characteristics of cancer for centuries. The cauterization technique, also known as fire drill, is still used today without the use of the fire to treat tumors and ulcers on the breast as described by the papers Edwin Smith, who treated 8 such cases. According to Edwin Smith's papers, there is only one documented case of a man with this disease, and no known treatment exists for it. This disease was untreatable for centuries, but soon after, in the 17th century, when the circulatory system was fully understood, medical professionals were able to determine how breast cancer and armpit lymph nodes are related. As people age, their risk of developing cancer rises. 1 in 8 women who live to be 90 years old have a lifetime risk of developing breast cancer, or about 12.5%. Even though the risk is lower for men than women, men can develop breast cancer as well. People who don't have children and have their first child late, don't breastfeed, get their first period early, go through menopause late, or take hormone replacement therapy are also at risk. Inflammatory breast cancer, which typically present at stage 3 and 4, is more aggressive in younger women and increases in frequency with age. Furthermore, the BRCA1 and BRCA2 is the two important genes mutation have been connected to prevalent types of breast cancer, and it increases the risk of the breast cancer in women who have a family history of the disease. For family might have an inherited form and cancer, genetic counseling and testing should be taken into consideration. Additionally, alcohol is a risk factor breast cancer. The risk of breast cancer in women increases by as much as 37% for those who drink 2 or more glasses of wine daily, and by as much as 6% for those who drink half a glass daily. That's all from me. Thank you.
Assalamualaikum and hi, my name is Aimbir Shazwana binti Mazuki. My matric number is 272553. I will continue the presentations with the case and the theories. The case of this breast cancer was taken from the article The Star on the date of 1st November 2022. The breast cancer survivor is Thelma Van Rooyen, 61 years old and lives in Windhoek, Namibia. She was diagnosed when she was turned 45 years old about 16 years ago. She was in disbelief and shock when hearing that she was diagnosed. She was able to survive because she got support from her family and close relatives. She works at Cancer Associations of Namibia. There are 2 theories are related with the case. First, health belief model. Construct of persistent stability where Van Rooyen feels shocked. Next is construct or perceived benefits, where she takes an actions by doing the mastectomy and chemotherapy. Last construct in HPM is self-efficacy, when she gives the courage and support to the patients and family of the patients. Second, theories is trans-theoretical theory of behavior change. First stage is pre-contemplations, where some patients are not ready to change their life from healthy to sick, like in the case when Ryan tried to help them but they speak to her in a harsh tone. Stage of action is when Hester Coach was encouraged and assisted to overcoming the emotional drain after hearing the news and story from the breast cancer survivor. That's all from me. Thank you.
My name is Tashila, daughter of Balasubramaniam. My metric number is 277520. Now I would like to explain about how breast cancer can be managed or dealt with in pharmacological and non-pharmacological treatment. Breast cancer can be managed by identification of individuals and relatives who has been diagnosed in cancer before this. In this case, if Thelma and Ryan had done as this, there were high chances for her to identify her diagnosis in the very early stage if she had been done the early examination as well. Besides that, in the pharmacological treatment, tamoxifen is also known as Nolvadex or Salvotax drug, which has been used to treat hormone receiver positive breast cancer. Once the medicine is within the cell, it stops the cancer from receiving access to the hormones it needs to multiply and grow. This stops the cancer from spreading throughout the body. In non-pharmacological way, it refers to therapy which is not used with medication to treat a pain or condition. If for physical and exercise, there was self-managed non-pharmacological therapy that were given to breast cancer survivor more frequently than any other type of intervention for the management of psychological and physical symptoms. Meditation, hypnotherapy, yoga, music therapy, stress management, relaxations, massage and relaxation are some of the other beneficial self-managed non-pharmacological therapies for breast cancer survivor. This has been also advised by the doctors for the breast cancer patients. Thank you.
Hello, my name is Nurul Aina Najwa binti Ahmad. My metric number is 272783. So I will be presenting about the management of breast cancer. So there are an algorithm that divide breast cancer management into 3 stages that are called early breast cancer, locally advanced breast cancer, and metastatic breast cancer. In the early stage of breast cancer, patients can manage the cancer by going for neoadjuvant systemic therapy, or be called as NASD, and surgery depending on the condition. NASD consists of 3 types of therapy that are chemotherapy, endocrine therapy, and targeted therapy. All varies to the condition of the patient, whether they need further medical attention or not. In surgery, 2 actions can be taken, that is either to do breast conceiving surgery BCS or whole breast irradiation, or to perform mastectomy and reconstruction if necessary. In the second stage, that is locally advanced breast cancer, patients are divided into operable and inoperable groups. For patients that are suitable to go for operation, 2 available ways for them are mastectomy and axillary surgery and neoadjuvant chemotherapy. If the breast cancer is inoperable, patients can also go for neoadjuvant chemotherapy. And as a result, patients might be able to operate on the tumor through surgery accompanied by radiotherapy and or hormone therapy and or trastuzumab. In the last stage, that is metastatic breast cancer, patients could be having visceral crisis. If there is the existence of visceral crisis and human epidermal growth factor receptor 2 or HEP2 is found to be positive, patients would be going under through chemotherapy. If the patients have no visceral crisis, there is still a chance for HER2 to be found positive, and they will have to go through the same cancer management.
meaning to say that most breast cancer management are dealt with the same way regardless of the stage and fully depends on the current condition and needs of the patient.
Assalamualaikum and hi, my name is Nurul Husna binti Zulhami. My method number is 272660. So I will continue for the last part, which is the consequence of dose management method for breast cancer patient. In early stage, the patient prefer to use neoadjuvant therapy and surgery. Neoadjuvant therapy is treatment with the goal to reducing the tumor. This therapy is a type of chemotherapy. Patient can get this therapy after or before the surgery. Adjuvant chemotherapy tries to eliminate cancer cells that remain or spread but cannot be spotted by imaging tools. It can reduce the chance of breast cancer to relapse for a second time. Neoadjuvant chemotherapy is given to the patient to shrink the tumor so that it can be removed with the non-existent surgery. This chemotherapy can minimize the risk of mastectomy since breast cancer reacts swiftly to treatment in early stage. For locally advanced breast cancer, two ways is available for them, which are mastectomy and axillary surgery. Axillary surgery have a few side effects such as lymph backlog in the armpit. Other than that, it may affect minor armpit soreness and numbness. Mastectomy surgery is a surgery that removes all breast to prevent and treat the breast cancer. The consequence is the cancer will not relapse and the patient may do plastic surgery for breast reconstruction. Last but not least, in the metastatic stage, the way to treat are chemotherapy and or anti-HER2. Patients with HER2 positive breast cancer should be treated adjuvantly with combination of anti-HER and chemotherapy. Trastuzumab is a kind medicine to inhibit this protein in tumor when HER2 gene is mutated. It can reduce the risk of relapse and mortality from tumor. With this medication, some patients may suffer heart failure, either permanently or temporarily. So that's all from us. Thank you.